I'm at Yanhee International Hospital in Bangkok, and they're internationally renowned for cosmetic surgery. We're going to talk to one of the cosmetic doctors, we're going to talk to the marketing people, and we're going to find out everything you need to know about cosmetic surgery in Bangkok. I'm down at International Reception, and I'm actually booked in to see a plastic surgeon who is then going to transfer me to an ear, nose and throat specialist because I have a deviated septum within my nose and I'd like to get it looked at. So the process is that you come in to the international services section, and then over here, that's where you check in. Then after you check in, you're allotted a translator, and this is my translator. It's nice to meet you.
Welcome from Yanhee Hospital.
And sorry, what's your name?
My name is Mr. Win. Yeah.
Mr. Win.
Correct.
Okay, well, I'm Marshall. It's nice to meet you.
Nice to meet you as well. Okay.
And Mr. Win is going to stay with me and make sure that I understand everything that's going on during the procedures and the advice that I get from doctors and so on. Can you just tell me that just over here are where all the translators are? How many translators do you have here at the hospital?
Okay. Currently, right now, altogether, we have 30 translators that is working in our interpreter department. And right now, the available language is about 12 languages that is we service right now.
Right.
Okay, yeah.
That's fantastic. These are the translators over here. Hello, everybody. Wow, what a fabulous resource. And these are the languages up here that the translators can translate into. All right, well, we're heading up now. Let's go. Of the foreign patients who come to the hospital, number one is China. Number two, believe it or not, is Myanmar. And number three, Australian.
Correct.
So if you book in for some form of cosmetic surgery that requires actual surgery and you need to stay overnight or for several days, this is the kind of room that comes in the package. So this is where you would stay. There's a sofa there and the bed, television, little dining table there, and quite a nice little bathroom. But if you wanted to spend a little bit extra and turn it into a VIP suite, that's 3,000 baht extra, this is what you would get. This is additional. For the luxurious stay, microwave, fridge, kitchenette, and a second bathroom. Not bad for an extra 3,000 pesos a night. Yanhee International Hospital is one of the largest plastic surgery centres in Thailand, with 18 full-time plastic surgeons who you can see behind me. We're in the plastic surgery centre at the moment, which is pretty big, and I've got to be careful about how I swing the camera around. But the top five main surgical procedures that are undertaken here at Yanhee International Hospital are breast augmentation and the variations of that, liposuction, facelifting, tummy tuck, and gender reassignment. I'm with Kristen in the breast implants room, and she's going to explain to us a little bit about the implants. One thing you do need to know is the numbers are the cc's, so the amount of liquid within the implant, which actually is what you pay for. So the bigger the implant, the more it costs. So this is the smallest?
So the smallest size that we have here is 225 cc.
This is 225 cc's. It's quite heavy, really.
So you have to imagine that on top of your existing cup size.
Yeah, right.
So that's already...
And this is the smallest?
This is the smallest, 225.
And that would give you a cup size of what?
Probably a C.
A C
This
cup.
one.
Right.
Added to your existing breast.
Yeah,
and
right.
then we have 325. So
325.
225 is like 100 cc.
100 extra.
So it's 325.
Right.
This one is 350. Sorry, 355.
355.
355.
This one.
And then the largest that we have here currently, because I don't see the other one, this one is 385.
385. And so this would take you up to what, a D cup?
So I'm not...
Something like that?
Yeah, something like that. So, and also you have to note that as each cup size go up, so does the weight. So it gets heavier.
Yeah, exactly. So this is 385 and this is 225.
So just, comparing the size.
And there is a big weight difference. To have two of these on your chest, boy, that's quite heavy.
And then on top of your existing breast.
Yeah, right. Yeah. Wow. But this will last how long?
That will last for at least, a decade.
A decade.
We do have patients who come here who've had implants for more than 10, 15 years.
Yeah, right. Wow.
So sometimes they come just because they wanted to either upgrade or to downsize, depending on...
So that'll last for 10 years. So with gender reassignment surgery, which they do quite a lot of here at Yanhee International Hospital, there's a vast difference in price and in actually the in complexity of the operation itself for the technique, for male to female and female to male. So with male to female gender reassignment, what sort of period of time, what sort of length of stay in the hospital would you be looking at?
For male to female transitions, they are usually in the hospital for 9 nights. So that's around 10 days.
Yep,
so that's included in the package. And you mentioned earlier the different techniques. So the price would vary based on the technique that they choose.
Okay, and those prices vary from?
Range from 395,000 to 810,000.
810,000, right. Okay, and then so for the other style of gender transition, which is female to male, that requires actually 3 different operations, doesn't it?
3 different operations, or we call it 3 different steps. So you have
3
step 1,
steps.
step 2, and step 3. And the steps, this is something that you don't do right away. So usually it would depend on how the patient is coping as well and on doctor's orders. So it's either they have to wait 6 months to a year before they go to another step.
Right, okay, so it's a very long and involved process, which costs considerably more, well over $1 million baht. All right, I'm going to see a nurse now and talk about my medical history. Sawadee Cup. Well, I've come in to see Dr. Orawan, who's a plastic surgeon, and I don't need plastic surgery, so I'm going to go up to the ear, nose and throat section of the hospital to talk about the deviated septum and how you would fix that. However, having an audience with a plastic surgeon is a fortuitous thing for our video, and so I'm going to ask Dr. Orawan a couple of questions. Firstly, hello, Dr. Orawan.
Hello.
Now, secondly, we've gone over different examples to try to make it as simple as possible. So if I was an Asian patient, for example, and I wanted to have the bridge of my nose made taller, what would that entail?
Okay, so it's actually not the same procedures as like Western patients. So in Asian, sometimes we have like a lower bridge here. So the easiest thing to do is like to put in something we call augmentation rhinoplasty, which means we can put in some implant, which can be silicone implant or it can be Gore-Tex. So it depends on you. If you want to do the surgery, I need to talk to you in detail about what kind of implant that you choose to put it in.
Right. And this is a relatively simple procedure as far as rhinoplasty and nose restructuring goes, and that's why we're using this as an example. Would this be a day procedure?
If it's only like an augmentation rhinoplasty, it's going to be like a 1-day procedure. Like you can come as an outpatient and go home on the same day.
But you would need to come back several days later, is that right?
So normally every surgery, I need to follow up my patient. So I ask you to come back 7 to 14 days after surgery. And in the long term, if you can, it would be best if you can come around like 3 months or something like that.
So the idea being that after the surgery, your face will be swollen. So you need to wait for the swelling to go down to look at the actual aesthetics of the job, which is 7 to 14 days. So if you were coming to Thailand to have this done, you'd need to book at least 2 weeks in Bangkok to have that fairly simple procedure. And then you would need to come back within 3 to 6 months to see Dr. Orawan, or go and see a plastic surgeon in your own country. And by the way, this is one of the implants, depending on how tall you want to make the bridge of your nose. This would be for an Asian person. This is what the implants look like. And so this would go like this, something like that. What kind of price, how much would that cost?
Okay, to start, it's gonna start around 40,000 baht, okay, just to put in some implants. But it really depends on what kind of specific procedure that you might need to add on, like you might need to use some ear cartilage to make the tip more refined or something like that. So
okay.
Yeah, depends on consultation.
So what would the price range be? From 40,000 up to what?
If it's also okay, up to around 90,000.
Okay. So if it's a bit more complex,
yeah,
then obviously it'll cost more. And now for our Anglo or Caucasian viewers, like myself, if I wanted to reduce the size of my nose, perhaps to have a slightly less bulbous nose there, what would that procedure entail and what's it called?
Okay, it's gonna be what we call open reduction rhinoplasty, which means I'm gonna open around here at your columnar area, which between the nostril, and open everything up to make the cartilage smaller and change the shape in order to make the tip more refined and less bulbous. So to do that, we need to here in Thailand, you're gonna let the patient stay in the hospital because it's gonna be under general anesthesia. You need to be safe, and you're gonna can stay in the hospital for 2 nights, and the cost for that will be 105,000 baht.
Right. Thank you for that. That was a very succinct explanation. So 2 nights in hospital. Would it require me having to come back in 3 months or something?
Oh, okay, normally if you're gonna have the wound here, so I will ask you to come back 7 days to check everything and to make sure,
right.
to remove the stitches and make sure the wound is good. And then, as always, I need to follow up in long term to see when the swelling goes down, what is the result. It's best to be 3 to 6 months to follow up.
Right. So with this kind of operation, you would need to book at least probably 2 weeks to be safe for your trip to Bangkok. And like the other procedure, within 3 to 6 months, you'd need to see a plastic surgeon or indeed come back and see Dr. Orawan for her to just check that everything's okay. Thank you so much for talking to me.
You're welcome. It's nice to meet you.
So we've looked at breast augmentations, we've talked about rhinoplasty, nose jobs, and we've talked about gender reassignment. So we're just about to go and see a doctor now who's going to explain all about tummy tucks and liposuction. We're in the consultation room with Dr. Krairat, and I'm also here with Mr. Win, who's my English to Thai translator. First, thank you, Dr. Krairat.
Hello everybody, I am Dr. Kairit Tiyakun. I'm working in Yanhee Hospital as a plastic surgeon.
Thank you. And this is, of course, Mr. Win again.
Hi, I'm Mr. Win. I'm working as an English to Thai translator in Yanhee Hospital.
You also translate
Burmese as well. Yes,
Burmese
correct.
as well.
Yeah.
First simple question is, because I don't know anything about tummy tucks or liposuction. Let's start with liposuction. Can you just very briefly explain what liposuction is?
Liposuction is the job that I remove some of the fat out from the body, okay? And after we remove the volume, the shape will getting smaller. That is general principle.
And the concept of that is body sculpting, right?
Yeah, correct.
I was asking Dr. Krairat if you need to if there's an anaesthetic, and if you need to in fact stay a night in the hospital.
If we talk about the principle, we just prepare the working area and we put the instrument inside, remove some of the fat out. Okay, and if the question is, do they need to stay in the hospital or not, it depends on the size of the working area.
Yeah.
If the working area is so small, we can finish the job under local anesthesia. In this situation, they don't need to stay in hospital. This is just day operation.
Yeah.
If the next case is the working area like a whole tummy, the working area is so big, I cannot do just local anesthesia. That's why I need to complete the job under general anesthesia. That this is the reason that why they need to stay one night.
They would need to stay a night in the hospital. Yeah.
Right.
And so with tummy tucks, I imagine that's a lot more involved. That sounds to me like, are there stitches involved and things like that?
Correct. Again, because of in the liposuction jobs, we just make the small opening like a 1 centimeters, multiple opening, and put the instrument inside and remove the fat, and then we close it. We just leave the wound 1 centimeter. But for the tummy tuck is so different, because of tummy tuck is the main problem is the skin and fat that have main problem usually almost always in the lower part of the tummy, and we need to get rid of that. The main thing is cutting.
Yeah, right.
When we do cutting in the large area, we need to do under general anesthesia.
Yep.
We need to take time to make a dissection, stop bleeding, and do the 5 stitches many layer of the skin.
So generally speaking, how many nights in hospital would that be? What length?
3 nights.
Three nights in
3
hospital.
nights in
Right.
hospital.
Okay. Thank you both.
I have one information.
Yeah.
One thing is that บอกว่าเป็นโอกาสอันดีอยากจะบอกว่าคนที่สนใจเรื่องการผ่าตัดเรื่อง cosmetic อะไรพวกนี้
The doctor wanted to take this opportunity to share one thing. So the doctor told me that when the patient decided to come and do the surgery, before they come to the Thailand, better to search and do some research on the procedure first before coming here.
What Dr. Krairit is suggesting is that before you come to Thailand, if you find out online that it's a lot cheaper to have it done here, you really should see a doctor in your own country to make sure if indeed a tummy tuck is for you, because it's not for everybody. They can't do tummy tucks to everybody. And some people just jump on a plane, come over to Thailand, Dr. Krairit sees them and then has to say to them, look, I'm sorry, but I don't think you're a candidate for a tummy tuck. So that's very disappointing. So find out as much as you possibly can and have some consultations with medicos for tummy tucks in your home country before you book in and come over to Thailand. I'm with Dr. Ornama, and she's going to have a look at my deviated septum, and I've just explained the situation to her, that when I fly and the plane descends, I get a terrible pain in my left eye and I get sinus pain in my head. And I can't dive deep down into a swimming pool or a river. The same thing, I get sinus pain. So firstly, hello Dr. Ornama.
Okay, good afternoon.
And we're with
Again,
Mr. Win again,
yeah.
and Kun Molly, and our nurse. Hello. I'm just wondering what Dr. Ornama has to say about what I've said. Are you going to have a look at my nose?
Yeah.
You will? Good. Okay. So where do we go from here? What do we do?
ไปกดเบียดรูระบายของไซนัสลูกหลาน
ได้ครับ
Okay.
All
So
right.
the translation is?
Yes, alright, so the doctor told me that we're gonna start by initially using the instrument to check inside the nose first, and then we're gonna do the endoscopy to see if there is any blockage on the sinus or not, okay?
Great. All right.
I will check inside.
having my checkup now.
Alright. Do not worry, okay? You are not going to get pain.
ข้างไหนที่เขาหายใจไม่สะดวกนะคะ
So which side that you have a difficulty
It's,
in breathing?
it's this side.
Left side, okay?
Yeah.
ข้างซ้ายครับหมอ
Yeah, you might need to.
Excuse me
อ๋อ น่าจะจริงอ่ะเขาจะได้ไม่เจ็บเลย
Right. Alright, so the doctor explained me that the doctor see it already, but however, by the instrument you cannot see it too. So we have to do the endoscopy to see the details inside the inner lining of the nose. So first we're gonna use the local anesthesia that is soaked in the cotton and put it on the nostrils each side, okay? And wait 20 minutes and see in the endoscopy.
So I'm getting a local anaesthetic.
Yes, correct.
Are you okay
Yeah, good. Oh, it's bright.
Okay.
ค่ะ โอเค
Alright,
Okay, so we wait
now,
20 minutes.
yes, you have to
Yeah.
wait outside.
Just about to have an endoscopy.
Endoscopy.
Endoscopic
Yeah.
something or other.
ขออนุญาตปิดตาชั่วคราวกันแสง
So we're gonna close your eyes, okay, with the close.
เดี๋ยวจะเอาหมอนออกช่วง
Alright, breathe through your mouth.
Excuse me
Open your eyes, okay? Sorry. Not remove.
คุณต้องห้ามบันทึกภาพไว้ด้วย
Oh, okay, right now. Alright, can you sit up?
Are you okay
Yeah, you can sit on the side, okay? You can
I'm
put your
good.
legs down here, okay?
Can I pull this off?
Yeah, you can put it that on.
Great.
Okay, sit here and we're gonna look through the videos here and the doctor gonna explain about the TV.
Oh, okay. So they've taken photographs and video inside my nose, and we're just going to view that video now. I've just had the endoscopic examination,
Yes, the examination.
and it was really quite thorough.
How
And
do you feel about it?
well, the explanation was quite involved.
Okay, so do you feel pain? Any pain?
No, there was no pain.
Okay, good.
No pain.
Alright, so
Yeah.
please have a seat and wait a moment, okay?
Okay. The operation's called endoscopic septoterminoplasty. Terminoplasty. I'm getting some help.
Yeah. Endoscopic septoterminoplasty.
Yeah, right. It just rolls off the tongue. And it would involve possibly 3 days in hospital. It's an hour and a half operation. It's fairly involved. And the price I've been quoted is 185,000 baht. So I'll have a think about it. And that's it.